BJ Deimel. I'm a physical medicine rehabilitation specialist. Mostly that involves treatment of people's spinal conditions, so neck and low back pain. I did a sports medicine fellowship, which then opens up to treat people's knees or hips or shoulders or any other types of musculoskeletal conditions. I've been with Ozark Orthopaedics 6 years now. I've been in this area for about 7 years. So my wife lives in Rogers, and we kind of always knew we were going to come back and settle here. And I transitioned to Ozark Orthopaedics after a year with one of the other hospitals, and been here and love it. We've got specialists in all areas, and so being able to work with the hand surgeons or the shoulder surgeons or the hip surgeons, or like with Dr. Randolph, a spine surgeon, man, that collaboration is just very powerful when you're treating your patients, and being able to send them to another specialist if they've got a condition that you don't treat. Well, I guess my specialty would be non-operative treatments for spinal conditions, and so that can include, is there certain types of therapy that would be helpful? And then from what we call interventional standpoint, it would be a variety of injections. So using special X-ray equipment to guide injections into certain parts of the body, and whether that's to help sort out where the pain is coming from or to try to treat that pain. And that can include epidural steroid injections, or what we call nerve burning or ablation of different nerves in the spine, and then things like implantable technologies. And so that includes spinal cord stimulation or even implantable pain pumps. So I got 2 children. I've got an 11-year-old and a 9-year-old. The 11-year-old girl plays travel softball. So in the spring and fall, like, that is our life. So we do that pretty much every weekend, and she practices 2 or 3 times a week. My son plays soccer, so he fills in the other days when we're not doing softball and all that type of stuff. But they're both, again, pretty good kids, and so school activities and those types of things, but sports outside of that. My wife and I will travel if we ever have a down weekend, so local areas here. Big Cedar Lodge is one thing we like to get away to. And then working out. I enjoy working out, so CrossFit activities and things. The way that I was trained, it was the right care for the right patient at the right time. I think the appreciation of the patients is what kind of drives me to continue that pursuit of, one, trying to make the diagnosis for the patient. And so whether they've just had this condition or they've had this condition for multiple years and have seen multiple providers, it's, are we treating the right condition? Are we making the correct diagnosis? And so that's what I really enjoy doing and pursuing, and all the different kind of tools that we utilize, from X-ray or MRI, EMG or electrodiagnostic studies, diagnostic ultrasound, and then these injections all play a role in how we figure that piece out. But making the right diagnosis and then seeing the treatment towards that diagnosis lead to better function and decreased pain in the patient. I mean, that's the most rewarding part of my day. And then the feedback from the patient is almost immediate. I mean, when you're in pain and that pain goes away, like it is really the pain can be life-altering on the front end, but life-changing on the back end if we can help with that pain and make that go away.